Managing fractured condyles with care.
What is fracture condyles and how this happen? Mostly the fracture condyles happen after trauma, and what I see in my daily base practice is that those traumas are mostly coming from the trotis, the new way of going around the city, and it's very dangerous because most of the people are driving it not flat way. There are many bumps, many holes, and falling from this two-wheel device, it's actually very dangerous. Mostly the people fall down on the front and they hit their chin, and when they hit their chin, the reaction of the muscles is actually to break our heads of the condyles. Also, direct trauma with the heat, or if we have some kind of things that fall on our side near to the ear, can also fracture the condyles. It's very important after this kind of traumatic accident happen that you check, is your teeth contact the same? Is your bite the same? Can you open widely as you did before? When you open, is your jaw go to the left or to the right? Or maybe some kind of shakes. Also, it's very important to see is there any click when you open and close after this trauma. And it's very important, if you have those, or if you have any kind of problems that you think it's necessary, you go directly to visit a specialist for that. There is a very conservative way to treat those fractures, and very successful, which I really apply in my practice. And we have many condyles that they reattach again even though they were broken, or remodulate or grow again. This way is by using splints and by using the very precise mechanism or steps that we follow to really reattach again the condyles, the broken head. For this also there is another solution, and mostly it's a surgical solution, and either the surgeons open the joint, relocate the fractures, which for me it's a very dangerous way. Also in the hospital they use some kind of metal sutures and they hold the upper jaw and lower, and they use some kind of headgear to keep the jaw backwards. For me this is also not successful way, because in the future the lower jaw starts to go left or right asymmetrically, and most of the time it's not successful way of relocating again the fractured pieces.